Lake Country and the official opposition Health Critic. I'd like to make a special thank you to him for proposing these regional town halls. With us as well are our guests, Cathy MacNeil, the President and CEO of Island Health, and Dr. Richard Stanwick, who's the Medical Health Officer for Island Health. Last month, our government organized a series of virtual town halls to help British Columbians bring questions to the people who've been leading the COVID-19 efforts across our province. And I'm pleased that we have another opportunity to get together and have your healthcare related questions answered by our public health leaders this evening. Before we begin, I want to take this opportunity to thank all of these workers, the leaders of Island Health and throughout the province, and those on the front line for everything that you've been doing for the people of BC over these past few months. It's been, to say the least, inspirational. Just a few minutes ago, I was outside along with many others cheering on the frontline workers. I live I guess on a hillside. Below me is a long-term care facility, and not far above me is our local hospital. And every night from the valley floor up, I hear people cheering on those healthcare workers. In my own neighborhood, I have doctors and nurses and healthcare workers and paramedics, and it's just a moment for us to take to be thankful to those workers for all that they're doing for us. And I also want to thank everyone across British Columbia who's watching around the island, particularly, all the efforts that they've taken to help flatten the curve. Our collective effort worked, but we know there's still work to do, and it's why we're here tonight to answer your latest questions. And I'm going to hand it over now to MLA Letnick to give us a quick overview of how this town hall will go. MLA Letnick.
Thank you. And, I really appreciate being here. It's great, MLA Leonard, and thanks to you for co-hosting this town hall, and for everybody out there for doing their part in flattening the curve. As you heard today, if you were watching the briefing by Dr. Henry and Minister Dix, only 2 new cases today. So congratulations to all British Columbians on making sure they follow the guidance of our public health officers all over in all the different health authorities, and of course to those of Dr. Henry and Minister Dix. It's great to be here this evening with all of you on behalf of MLA Stillwell, and as MLA Leonard said, everyone in BC and on the island should be proud of everything they've done thus far. So I won't take a lot of your time. You've already heard a great introduction by my colleague MLA Leonard. So it's my pleasure to introduce again Cathy MacNeil, the CEO of Island Health, and Dr. Richard Stanwick, Medical Health Officer for Island Health. And Cathy and Richard, I think you said it was okay to call you Richard, so we'll do that. And Ronna-Rae, you can call me Norm, that's good. They will be answering your questions this evening. And perhaps you might want to introduce yourselves to the people that are watching.
Sure. Well, thank you. And my name is Cathy MacNeil. I have the privilege of serving as the President and CEO of Island Health. And it's good to be with you all this evening. This is our second time, Richard and I tag teaming. So hopefully we'll learn from our first round and perfect the performance. I too would like to acknowledge the fact that we are speaking to you tonight from the traditional territory of the Lekwungen speaking people of the Songhees and Esquimalt nations, and also recognize the Lisanic people whose traditional lands we are working from here in Victoria. And I also want to thank Ronna-Rae, Leonard, and MLA Letnick for acknowledging the tremendous efforts of our community and of our healthcare team. We're tremendously proud of the team we have here at Island Health.
Richard.
Richard Stanwick, I'm the Chief Medical Health Officer, and I just wanted to again acknowledge all of the fine work and flattening the curve. And while people speak about the frontline people, I just always like to remind them that one of the reasons we were so successful was the frontline public health people who were the contact tracers, the individuals who followed up with people who were symptomatic, the individuals who swabbed people in their cars. It wasn't as glamorous as wearing the full PPE in the ICU, but it certainly contributed significantly to Island Health and it was very, very sad, 5 deaths, and 196 cases. So a lot of this just speaks to that BC took the lessons from across the world, applied them, and probably from a public health perspective, had a population that recognized that this is probably a source of truth. And by following and partnering with us, we did this together. And I'm so pleased to be part of this community. They're banging the pots, but I'd like to get out there and bang the pots for our community because they made the difference.
Thank you, Richard, and thank you, Kathy. In advance of this town hall, we've asked British Columbians to submit your healthcare related questions on COVID-19. And MLA Leonard, Ronna-Rae and I will take turns in reading out those questions to our 2 panelists who will address them with excellent answers. If you didn't get a chance to submit a question ahead of time, you can still submit a question now, but you have to do it from the Government of BC Facebook site. So if you're watching this not from the Facebook site, then go to Government of BC Facebook site, and then you'll be able to submit your questions live to our 2 great panelists. So in fact, you can send your questions right now. We're taking questions as we go along. First, we'll start with the ones submitted ahead of time, and then we'll hit the live questions, and we'll do our best to answer all your questions tonight. Should we have more questions sent to us than time, then the Health Authority will get back to the individual writers with answers as time permits. So let's get started. Ronna-Rae, over to you.
All right. Okay, the first question, and it's one that many people all over BC are asking about. This is a question I'm sure you hear a lot. In fact, we received a lot of variation on this very question. Amy of Victoria is hoping to get something cleared up. Because WorkSafeBC has recommended making use of non-medical masks to many hair salons and other personal services as a guideline, businesses are now mandating them. I feel like I'm smothering in my own CO2 when I wear any type of a mask. And now I'm being denied entry into businesses that I frequent. Is this legal?
Well, the guidelines are the ones that are expected of businesses to follow. These are based on risk to the employees. And I know while this is probably obviously a significant inconvenience to this individual, the WorkSafe's primary responsibility is to the employer or the employee. And I can tell you that public health had input into these guidelines. So until we can flatten the curve or get even further and get a vaccine or a treatment, this is the only way in which we can continue to basically restart the province, but not see the virus reintroduced. So that business is actually following WorkSafeBC guidelines, and those are supported by public health. And unfortunately for basically the questioner, those will be the rules until we basically have treatment or a vaccine.
Thank you for that. Similarly, Stacy from Victoria says, we were told wearing masks is a personal choice, but many businesses like Costco, Uber, grocery chains, etc., are making it mandatory for clients to wear masks before entering the premises. But masks aren't always available everywhere. I recommend either stop these businesses discriminating by not allowing us to enter without masks, or make masks available for purchase at an affordable price. Would you have a comment on that?
Well, we have a situation where these are private businesses and they can set the rules. I mean, in the old days, pre-pandemic, no shirt, no shoes, no service. And those rules held. Here it's a little more serious in terms of trying to avoid a virus being spread. And it's an extra level of precaution that these companies have chosen to take. And since they're private establishments, we're not in a position to overrule them. I do feel badly for the questioner if in fact they can't secure a mask. We're hoping that over time that there will be groups that will make masks available to the public generally for people who can't afford them or who can't access them. But we do ask that they do not turn to the medical grade masks. We still need them. Wave 2 may be coming, and we need to keep those for people who are using them for treating individuals and keeping the virus at bay.
Thank you, Richard. That actually, somebody dropped off a pattern for making a mask at my door on the weekend. As Amy pointed out earlier, WorkSafeBC recommends masking to personal services as a guideline. Kim from Nanaimo has a question about the use of PPE or lack thereof in some personal service businesses. Why is PPP not mandatory for physiotherapists and massage therapists? We shouldn't have to tell them to wear protective gear. It should be mandatory. If they don't have PPE, then perhaps they should wait to open. Also, are they legally allowed to have their clients sign a waiver in case they get COVID-19 during their treatments? It doesn't seem fair. If we are in a pandemic, everyone should wear PPE.
Well, I will perhaps tackle that second portion of the question. In terms of the legality of the what it seems to be almost a consent form or a waiver, that I would leave to perhaps the legal beagles at the Ministry of Health as to whether that's binding on the individual seeking service. With respect to the first part of the question, unlike basic people who perhaps are hairstylists, physiotherapists are a professional group, and they are actually bound by a different set of guidelines. These are for professionals, and this one specifically is, if I can get the title right, it's Infection Control and Prevention Guidelines for Community Service Providers in Clinical Settings. And they specifically speak to PPE as part of the assessment of the client. If you can maintain and provide service 6 feet away from the individual, and that's basically the guideline that Dr. Henry and Minister Dix have emphasized time and again in terms of physical distancing, there is no need for PPE. The second part of this is the clinical judgment of the practitioner. And if they assess that they are not going to be putting themselves or the client at risk by doing an assessment, asking the people the very same questions you've heard probably 30 times from Dr. Henry, do you have any symptoms of COVID-19? Do you have a cough? Do you have a sore throat? Do you have a headache? And going down the list. And if they can make a determination the individual is likely free of COVID-19, they can in fact engage in a therapeutic relationship with that person and not use PPE. If in fact they find somebody has symptoms, I suggest that they will probably end up instructing that person to go to the nearest testing center, get a test and find out whether it is COVID-19. It may just be a cold, and then again, they would be reassessed for therapy. So it's a very different situation involving the personal services delivered by professionals like chiropractors, physiotherapists, and kinesiologists.
Thank you for that comprehensive answer, Richard. And Kathy, I'm sure there'll be some questions coming to you too soon.
That's okay. I rely on my friend Richard.
The next question is from Cheryl and Victoria about PPE as well. Cheryl asks, as a community support worker, I do personal care support that requires me to be in close proximity to adults with diabetes. We all support who have been in isolation. No going out and only essential visitors since March the 16th. However, they are exposed to a lot of different staff. We all do temperature checks each shift. Should CSWs, so community support workers, wear PPE beyond gloves to do personal care, etc., for example, teeth brushing?
Is the questioner raises a really good point. Probably in those circumstances, the greatest likelihood of introduction of COVID-19 into that setting is likely going to be from a fellow worker, because people who are circulating in the community, particularly in the early days, were much more likely to see community spread. At this point in time, the suggestion is that people need to assess their own state of health. And I think probably the best advice I could give to that questioner is, if you're sick, stay home. In terms of the personal PPE, if you are feeling well, basically deliver care as you would normally do so. I think the good news is, right at this point in time, we know there's, at least on Vancouver Island, there's very little virus circulating in the community as best we can tell from the surveillance that we're doing. So it would be a relatively low risk encounter. But again, whether it's a physiotherapist or a community services worker, do your clinical assessment, look at that temperature. And again, if anybody's feeling ill, that's the time not to provide service.
Okay, thank you. As many businesses are gradually reopening, it is important to ensure guidelines are followed. Anne from Nanaimo asks, who is going to be monitoring that businesses are in compliance?
Very good question. Now, this is sort of split down the middle, though most of the work will fall to WorkSafeBC. All of the businesses are expected to look at the guidelines and then develop very detailed plans on how they're going to meet those guidelines. Those guidelines, once they've been basically digested by business, and I will not go through all of the steps because they're quite comprehensive. Once that plan is ready, the business will post those, how they've responded to the guidelines. Customers should be able to see what basically expected or what the business has done in terms of compliance. WorkSafe has assured me that they will be having their teams going out into the community and checking on those businesses. The other group are our environmental health officers who oversee many businesses such as restaurants and personal service establishments, and they too will be checking those plans and making sure that the businesses are in compliance, as well as meeting the other requirements of the different acts, such as the basically Public Health Act for Food Safe, so that there will be actually a number of groups out there looking at those plans in a proactive fashion. But if people have a complaint, they can either call WorkSafe or they can call their environmental health officer. And those numbers are basically listed in the blue pages. And of course, it was suggested, I think, by the Premier, if you don't get satisfaction, you can call your local MLA.
Well, we'll leave that one for another night. Speaking of following the guidelines and safety measures, Helen from Gabriola Island asks, given that the primary route of infection for COVID-19 is either droplets or virus transferred from a surface to the face, how can we send children back to school safely who are too young to remember the safety protocols, too young to maintain good hygiene, and in an enclosed environment for several hours where maintaining social distancing is impossible?
We've certainly looked very closely at basically children and transmission of the virus amongst children. And certainly most of the evidence to date suggests that the virus is spread not from children to adults, but most likely from adults to children. Children can spread it amongst themselves, but again, the disease tends to be very mild, though we are getting some disturbing rare examples of a vasculitis. So it's not absolutely benign in children, but it does appear that that is an age group that is largely spared. And with the usual precautions in terms of cleaning surfaces and reminding children, at least in terms of basic hand washing and acquiring some of those skills, it's a much lower risk environment than, say, one would find in a factory where people are in close proximity and adults, where again, the likelihood of transmission is going to be much greater.
All right, thank you. Being outside and maintaining physical distancing is better than meeting with our family is better when meeting with our family or friends. In the same line of ensuring that safety protocols are followed, Lou from Nanaimo Bay asks, with parks opening up and the virus stays active for a while, what caution should a person follow on park benches and especially picnic tables?
Well, that one is fairly straightforward. Again, the magic 2 meters in terms of distancing on the bench. For people who are using picnic tables, I would suggest that they bring along some of the sanitary wipes. I won't mention any brand name, but if you're going to be placing food on those picnic tables, you certainly don't want to be touching the table in the back of your hand and somehow contaminating your food and ingesting the virus that way. So without being excessively compulsive, I think that's a source where a site where you should wipe that down thoroughly with some form of sanitizer, let that dry thoroughly and remove any chance of the virus being present on an eating surface.
Or we can use a tablecloth.
Or you could use a tablecloth, but then wash the tablecloth afterwards thoroughly.
Right, okay. Going on walks or hikes in parks, for example, is not only better when we meet other people within our bubbles, but it's also a good way to get some exercise. There are also other ways to stay active and safe. So Suzanne from Victoria asks, I miss swimming and water walking in the Commonwealth Pool deep dive tank. In addition to social distance requirements surrounding water recreation, what do we need to know about COVID-19 transmission in water? Please describe the safety of shared public pool and lake water as well.
Now, the good news is that we have not seen any reports of people catching COVID-19 from swimming in lakes and swimming pools. Where the risk lies is basically in the change rooms, where people have to observe good showering and then hand washing probably after getting dressed again, and maintaining that distancing in those locations. Again, it's just reminding yourself what you practice outside the shower room and the locker room has to be practiced inside the locker room. But water per se is not a significant risk in terms of swimming pools and lakes.
Thank you.
In regards to being outside, meeting with our bubbles and maintaining physical distancing, Christy from North Park, Victoria asks, as a senior with a bad heart and lungs, I realize that with the compromised health situation, is it going to become more dangerous in terms of potential contagion? And should I be keeping my distance as much or more?
Well, that one is fairly straightforward. Given the chronic health problems, I think the only thing you have to do is maintain the behaviors. If you've been following the 6 feet in terms of the social distancing. In terms of bubble, whether you want to expand it or not is something you may want to think about, and perhaps keep it simple and stick to perhaps a much closer circle of friends and contacts than perhaps we're going to be seeing moving forward. People with those sorts of circumstances are, as described, are at greater risk, and they may need to be a little more cautious, but the physical distancing does not have to be any more extreme. You do not have to have 20 feet.
All right.
Taking care of our seniors, especially in these unprecedented times, is essential. And Susan from Victoria asks, my mother recently had a fall in her long-term care facility. So did my dad when he was around. It resulted in a hospital visit for a cast. He had a displaced, fractured ulnar. An ambulance took her, but I was asked to take her back in my car. She now has a follow-up to do. I take her? Question mark. Let me say the last question because she now has a follow-up. Do I take her? Question mark.
That's very interesting because certainly under the orders that Dr. Henry has put in place in terms of visitors, it would be highly unusual that this individual would be asked to take basically their mom home. The way we have been doing it is that as part of a care plan, if somebody has to leave the facility to go to the hospital for either an X-ray or for an emergency visit, they're accompanied by somebody from the care home, or arrangements are made so that there is continuity of people who really do understand infection control procedures, so that when they come back to the facility, they don't have to go into a 14-day quarantine. I'm just wondering if this is more like an assisted living facility where people would be able to have, in fact, more visitors. But in this case, again, if this person is a primary caregiver or part of that internal bubble of this particular person, his mother, then I wouldn't see any problem with them basically being together, because that decision was made to be their particular bubble of contacts. But again, I would find it surprising that this was a long-term care facility.
So if Susan wanted to follow up and get an answer from someone, would she be calling 811 at this point, or who should she be calling?
Oh, that, or depending whatever health authority. I think, did you mention the city was Victoria?
Yep.
Yeah, so they could basically call the health authority, basically, or licensing, or basically the medical health officer number, and we would be able to give a more detailed answer on this one.
All right, thank you very much.
Okay. As we age, we need more health supports, such as access to hip, knee, and cataract surgeries. And last week, health authorities have been calling patients who have had surgeries delayed by circumstances of this pandemic to prepare for resumption of non-urgent scheduled surgeries this week. Daphne from Victoria asks, will cataract surgeries be available soon? I've been waiting since February 2019.
Yes. Well, Daphne, we know that has been a very unfortunate consequence of this time, is the length of time we've added to people who've been already waiting too long. So here at Island Health, we are about halfway through the number of patients who were postponed during the time of slowdown for COVID-19. And today, all of our surgery rooms came back up to normal activity. And so we anticipate by June 15th, we will be kind of in our, what I would say, overflow activity. And when I say that, I mean extended hours. And those extended hours are important because it actually takes longer now. There's extra cleaning that happens between cases. It takes longer to do the personal protective equipment. And we're doing things like assessing patients for surgery using virtual care and doing extra assessment to make sure people don't have symptoms of COVID-19. So all that to say, yes, we're working hard to make sure that cataract surgeries, hip and knee surgeries, any of those procedures that have been classified as elective, we're back up and running. And as of today, those slates started up.
So on a similar topic, access to these surgeries, very important for people, as all people, including healthcare workers. And Rhonda from the Nanaimo has this question. I've seen that people needing hip and knee surgeries are not being prioritized. However, if someone is a healthcare worker whose surgery was canceled just days before and who can't work because of a severe joint problem, can they be fast-tracked?
So typically we don't fast-track healthcare workers. We treat all patients equitably as they're in the lineup. However, surgeons assess their patients based on urgent or emergent categories. So depending on whether they're losing sleep, they're losing function, there's a higher rate of pain, they're using pain medication, all those things go into the assessment of urgent or emergent and would influence or I guess would dictate where Rhonda would find herself on that booking list for the hip and knee procedure.
Okay. With the novel coronavirus pandemic, many medical services have been paused, and this is starting to affect people who need access to these services. May from Courtney Comox asks, having severe knee and hip pains for months. My doctor ordered an X-ray, but I can't have them done at the hospital because of COVID-19. Would like to know when it will be open.
That's a great question as well. And I think May speaks to the again, the pain and suffering that goes along with not having these diagnostic procedures available. So during the period of the pandemic, we were still doing emergent medical imaging studies as people were either coming through the emergency department or might have needed urgent surgery. We just started today rebooking what we call semi-urgent procedures. And we're hoping within the next week, we'll be able to start to call the patients who are in what we call elective procedures. So depending on where May's physician has assessed her and where what criteria she's met in terms of those assessment levels of semi-urgent or routine, she should be hearing from her doctor's office, I would say within the next couple of weeks, in terms of trying to reach out to those patients we're trying to reschedule.
Thank you. And Joan has a similar question, and she asks, when will the Nanaimo Pain Clinic be open at NRGH?
Yes, that would be great to be able to give you a date. I unfortunately can't give you a date tonight. However, what we're doing is working through all of our ambulatory clinics. While we still have COVID-19 in our community, we're having to put extra precautions in place for our ambulatory clinics. And the pain clinic, for example, is a good example of a clinic that did things like group classes or group therapy, would have group exercise, or there'd be much of the modality was done in a group. So that needs to be revisited based on the physical distancing requirements. Also, the ability to use virtual visits as part of the suite of offerings in the pain clinic. So the ambulatory care clinics, of which the pain clinic is one of them, they're all working through what their service model is going to look like in the context of COVID-19, now that we have these parameters. And I will say, the parameters that are in place by WorkSafeBC for businesses also apply to us in healthcare. So those same steps, those guidelines that are being put in place for the business community, we are adhering to as we ramp up health services. So the requirement for facilitating physical distancing, ensuring that we have policies that enable people to work from home if possible, where we're putting plexiglass barriers in place to protect people. And of course, the protections that are afforded with personal protective equipment or PPE. So our plans for ramping up include us working through that hierarchy to ensure that our healthcare team members are protected while we're going back into our service delivery.
All right, thank you. Pausing elective surgeries and other services were put in place at the time because we needed to flatten the curve and stop the spread of COVID-19 in BC. We also asked people to avoid non-essential traveling inside and outside the province. Jean from Saanich has this question. Is it now acceptable for extended family, grandparents, to travel between regions of BC to visit each other at home, provided that everyone has been cautious with their socializing, etc.?
Well, that's a tricky question because, as Dr. Henry said, that she is now talking about a double bubble. And if the grandparents are, in fact, that double bubble in terms of the expansion of the individuals that the family is reaching out to, absolutely, that would probably be acceptable. Though at the same time, we're asking people not to travel if at all possible. So it's a bit of a mixed message. I think people will have to judge whether or not they could in fact link virtually through Skype or some other means of making those connections. Again, it's one of those very difficult calls, and particularly if these people are older, the risk is greater. And so I think they have to weigh the risks of engaging in that travel, extending the number of people they're in contact with versus what they can accomplish by doing it virtually, and again, reducing the likelihood of them being exposed to COVID-19.
So in a related travel question, Dawn from Courtenay would like to know if driving to Regina at the end of June to visit her daughter is possible.
Well, again, the reason is if it's just for a visit, I think we're still hearing that if we could curtail travel, staycations are in order. We certainly are not suggesting that if, for example, there was a medical need, and we've certainly had examples where people have needed the help of their family, that we have certainly not impeded or suggested that they shouldn't. But purely for social basis, I think it still may be a little early, as Dr. Henry keeps telling us. Go slow, please.
Mm-hmm. Yes. In this beautiful province we live in, with gorgeous views in every corner, it's not surprising that family and friends from outside of BC want to come visit, especially during the summertime. Susan from Nanaimo poses these related questions. Out-of-province family and friends look forward to vacations touring beautiful British Columbia. What can you tell British Columbians about whether it might be safe to host guests under the same roof, particularly if they wish to stay in your home for days to even weeks? I don't know if I would do that, but do you predict this might be discouraged? Example, too many changing social bubbles throughout the summer.
I think there would be a question just about answered itself, that the major concern, of course, is that we have done amazingly well in British Columbia because we have taken on all those social and physical distancing measures. They've taken, I think, some very significant steps in terms of curtailing business activities. And we know that the virus is still very active in Ontario and Quebec. And one of the things we do in terms of our contact tracing and our surveillance is looking for imported cases. And I think that the message has been, please, this summer, if at all possible, stay home. But at the same time, for BC people to support our tourism industry, to do our own staycations. There are marvelous things to see in our own communities. These businesses need us to come and see those wonderful things we show everybody. And perhaps what I would suggest is that you become very familiar with all of the tourist attractions this year, so that next year when they come and visit, you can show them all.
Good answer. So thank you very much for everyone who submitted a question ahead of time. We didn't have a chance to get through all of them. We'll now switch to the live questions. But as I said at the beginning, the Health Authority will endeavor to answer your questions offline at some early date coming up. So our first live question comes from Pauline. And Pauline asks, regarding visiting seniors in long-term care, have virtual visits as an option been developed so family and their senior family members can have a visit, allowing them to have the comfort of seeing one another?
Richard, would you like me to
Sure, Kathy, why don't you, because this is a really important thing we've done.
Yeah, I think, again, this is a really good example of where community comes together. And so across the island in various long-term care both Island Health owned and operated and affiliates and some of the private long-term care facilities. Foundations and others have come together, and we in Island Health have distributed iPads to enable those virtual visits to occur. And so there's a range of ways that people are connecting with their loved ones from the online way, the virtual visit. I know there's window visits that are happening in various facilities where their family members can come outside and they talk to each other through phones and are able to see facial expressions and just be that sensation of being close. So I think there's lots of creativity on that visitors front. And again, as I said, want to really thank the generosity of communities and of some of the charities who have supported our residents in long-term care so that they could stay connected with loved ones.
Thank you.
Here's a question from Sheila. And can you clear up the confusion around healthcare workers only being allowed to work in one site? Can someone working at a long-term care site also work casual shifts in a hospital setting?
That is one of our HR issues that we have struggled with, and I think at the present time that we will be going with the ability for people to work in a single long-term care facility and also provide some services of acute care. Other health authorities have looked at this, and given the PPE that is required within our hospital setting, that it probably is a lower risk than somebody going from a long-term care facility to long-term care facility. One will not be allowed to unless you fill a special role, such as a physician or a podiatrist, in terms of attending more than one long-term care facility. So we've got what I would argue is a largely cohorted approach to staff. And we learned that lesson the very difficult way in watching what's happened in the Lower Mainland, but even worse, some of the very tragic situations in Ontario and Quebec. So we're being extra cautious with our long-term care facilities because those are the most vulnerable individuals in our system, and the slightest thing can jeopardize their health and spread the virus.
Another good question comes from Candace, and Candace says, should we wear a mask in our small circle of family get-togethers?
Well, it depends on what small is. Some people would say an extended family is 3 people, and so it could be 30. And I think that the main thing that we have to remember is that those masks worn under those circumstances are largely protecting people from your own droplets. We had this conversation with Bonnie Henry just this evening, and she's saying in terms of the public setting, if everybody wears a mask, I'm protecting you from my secretions, you're protecting me from your secretions. And some people feel more comfortable, even in smaller social settings, wearing the masks. I think we've gotten a little more flexible in terms of saying if people want to take these steps, do it. The critical thing, though, is just as with other masks, including the medical ones, if they get wet, if they get soiled, they're not doing anything of value. So the other piece that you have to commit to is properly maintaining them, and that is keeping them clean and dry, and when they're and particularly the cloth ones, launder them regularly.
Thank you.
Sky has a question. Have schools and places of worship been given any instructions on public singing?
So, you want me? Okay, Kathy, I'll have you singing a different tune.
I love to sing, but I'm not an expert on it, so I'm going to give it to you.
No. I can barely carry a tune, so I'm probably the wrong person to ask. But the question that people have speculated on is when people are singing that perhaps with the really good ones that can project their voices, that maybe they can send their droplets further than the 2 meters. And certainly we wouldn't expect somebody who's singing to wear a mask. That would certainly defeat the purpose of enjoying their voice. So some people have said that maybe, and again, I think this is yet another example where somebody will probably have the time and energy to study proficient singers and seeing if in fact their droplets go further than others. And so this is just a precaution based on, one would perhaps say is an understanding of the vocal talents of some of the people we know. So again, I don't know what Michael Bublé would say, but at this point, you may want to exercise a little bit of extra caution.
I think everyone's protected when I'm singing because it's only in the shower. Tanya says, or asks, regarding the BC Centre for Disease Control survey, can you provide an estimate of the number of serology tests the province intends to do and when?
That's a very good question. In terms of one, I want to say I want to thank everyone who's completed that survey. Just for the people who are watching this who may not be aware of it, yes, I did it too. This is a survey that BC CDC is giving the public their chance to tell us what it's meant socially, emotionally, economically, what it's meant to your relationships, and how good a job do you think has been done in terms of dealing with COVID-19, with the options to actually engage in serological follow-up and even the monitoring of symptoms going forward. So this is, again, the community being part of the solution and giving us those answers as to, how did we do, what should we do, how can we do it better? And certainly in speaking to BC CDC, the intent is to do as much serology as possible, because that will give us a good insight into how deep did this virus really penetrate into our community. Some of the early surveys from other jurisdictions have shown only about 5% of the population actually contracted the disease. Some people were predicting it was going to be much higher. So the only way we're going to find out is actually by doing it in BC.
Okay. I answered the survey too. Still trying to convince my husband to do the same.
Yeah. We want you to answer this. This is the one commercial break in the whole piece.
That's right.
Please, CDC survey.
Helga asks, how will the current COVID-19 survey guide our planning going forward?
Well, in particular, what it will do is identify those measures which people felt were useful, ones that they found more challenging, circumstances in which they perhaps identified where, for example, from an economic perspective, where people were hardest hit. What were the programs that perhaps were of greatest benefit? We have to remember there was never a blueprint for COVID-19, a pandemic. It's been over 100 years since something like this has come along. So nobody really had a plan on the shelf to be able to address this issue. So in many ways, we were learning as we were going. And so this is a great opportunity for us to gain these insights from the people who are being directly affected. And again, it goes to this partnerships we've had with the community. We flattened the curve together. And here's another chance for you to have your input in terms of how we can go forward as a community and as partners.
Cynthia has a question for Kathy. She asks, please clarify the use of PPE for registered care aides caring for a new resident in isolation in a long-term care facility. She says, I wear gown, gloves, and mask with eye shield when going into a room to provide care. Is it still necessary to wear a gown if going into isolation residence room when going in to deliver a meal tray?
So that description that she gave was really what is used when you're doing any kind of procedure that you might be exposed to aerosolized secretions. So gown, gloves, mask, and an eye shield. I would have to defer to my colleague, Dr. Stanwick, on the risk assessment or the risk exposure of being coming into contact with aerosolized secretions when you're delivering a meal tray. If the patient, and we talk a lot about doing a risk assessment of the patient before you go in or before you don your PPE, because if the patient's coughing a lot, if they're sneezing a lot, if they have secretions, then you should always take all those PPE precautions, even if you're going in to clean the room. So I think if the patient is coughing a lot or if they're sneezing and you're going in to deliver the tray, yes, it does. You'd better be safe than sorry. And so wear all of that PPE as you would if you were going in to do another kind of treatment. Richard, would you add anything to that?
Absolutely. And I think, Kathy, as you mentioned, that some of our patients who are in our long-term care facilities do suffer from dementia and other cognitive impairments. And you can't expect them to fully cooperate in terms of don't sneeze or cough on me. They're not going to practice those measures that are going to protect the people around them who are caring for them. So you absolutely nailed it. And the safest thing is once you get into a routine, as you're suggesting, in terms of dealing with people who have it, really reduce the possibility of passing it on to somebody else. So no, I think those are prudent measures under those circumstances. And again, we just have to look at what's happened in long-term care facilities across this country to know why those precautions are so important.
Thank you for that. And I'd just like to share that this will be our last question as we wrap things up. Question from Keely. We need to know the safe ways to wear masks and gloves.
The good news is there's lots of good instructional videos from basically BC CDC. I think even Island Health has put some together. Now, again, it depends on what the purpose is. If it's for just the general public, again, even the cloth mask. I have seen people when you're wearing at the bottom of your chin, or people have actually cut a slit in their mask so it's easier to breathe. Yeah. Oh, I mean, it's a source of humor on the internet, except, that dealing with COVID-19 isn't a joke. But there are good instructional videos. Probably the gloves are probably less important than the mask in terms of the droplet precautions. And I think a lot of my colleagues said the problem with gloves are that people sometimes forget that they're not a super barrier that the virus dies on, but they can as easily be transmitted on gloves to your face and your eyes and your nose as a bare hand. So good hand hygiene beats gloves every time.
So as Emily Leonard had said, as Ronna-Rae said, we're winding down, and I've been given an opportunity to ask a final question. So many to choose from, I don't know where to start. But how about this one? I live in Kelowna, so that's Interior Health. Interior Health region, along with Northern Health and Vancouver Island, have not seen the numbers that we've seen at Fraser Health and Vancouver Coastal down in the Lower Mainland. So now that we're in phase 2, do you anticipate opening up the province in different ways in those areas that have been most impacted, like Vancouver versus Vancouver Island, Interior Health, and Northern Health?
Yeah, it's a good question because, as you say, we've all had a slightly different experience with this virus, and yet we have tried and made significant efforts to have a system-wide response. So as we plan for phase 2 and phase 3, whatever that looks like, we're cognizant that we need to be doing it as one health system. It may look slightly different, and there may be, depending on the context or availability, what services could go faster or slower, but even things like visitor policies and those kinds of decisions, we're trying to stay as aligned as possible so that we are one health system moving forward. And our minister is very supportive of that we look at this through a system lens.
Thank you. And over to you, Ronna-Rae. Okay.
Thank you, Norm. Yes, I think that that sort of sums up the root of our success is that cooperative, collaborative effort. I want to thank you, Kathy and Dr. Stanwick, for your time tonight. I'd like to just share a little bit about how COVID-19 has impacted the people in my riding, in my constituency. We have, I think the most poignant comment I could make right now is that we normally have the snowbirds come to visit at this earlier in May, and of course they couldn't come this year, and the connection with that team is so strong and so important. And I was talking with the base commander today, and he just sounded so sad, and the loss is pretty traumatic for this community. They had people on the ground 3 hours after the accident up in Kamloops. And so the heart of this whole community goes out to them. Mm-hmm. And they have worked hard to work in tandem, even though it's a national defense installation, to work in tandem with what's going on in our community. And the impacts have been great for families, for vulnerable children and elders, for our long-term care residents and their families, for businesses who have done a tremendous job of towing the line and being 100% committed, and they're continuing with that. And I'm sure it's that way across the province. And I just thank you so much for taking the leadership role that you have. And I would like to thank you all for joining us tonight. And to my co-host, Norm Norm Letnick and Dr. Stanwick and Kathy. Before we wrap up, we want to leave you with a few additional resources. Normal, would you like to share the first?
Sure. So for provincial support and COVID-19 information, please visit gov.bc.ca/COVID-19. This includes non-health related information such as financial, childcare and education supports, travel, and essential service information. This information is also available by telephone. You can call 1-800-COVID-19. That's 1-888-COVID-19. That's 1-888-268-4319, 7 days a week between 7:30 a.m. and 8 p.m. Pacific time. For the latest medical updates, including case counts, prevention, risk, and testing, please visit the BC Centre for Disease Control website at bccdc.ca. Over to you.
Okay. If you or a family member need additional medical advice, please call 811. And for seniors looking for additional support at this time, please call 211 or visit bc211.ca. You can also go to bc211.ca to sign up as a volunteer to support our seniors staying safe. And I know that we need every hand that can come forward. For folks on the island who have questions or concerns about their care experience with Island Health, please contact their patient care quality office at 250-370-8323 or toll free at 1-877-977-5797.
You can also find information and links to these and more additional resources in the description of this town hall down below. If you haven't already done so, please fill out the province-wide public health survey. There's another public service announcement. BC COVID-19 Speak, : your story, our future. Local data are essential for communities to support public health planning. Your input equips medical health officers across British Columbia to support our health and well-being as we learn to live with COVID-19. The survey takes about 10 or 15 minutes to complete, and I can attest to that. So can, I think, all of us on this call. You can do it online at bccdc.ca/COVID-19 survey. Just go to the BC Centre for Disease Control, you'll find it. Or you can call by phone at 1-833-707-1900. That's 1-833-707-1900, 7 days a week between 8:30 a.m. and 4:30 p.m. And since that's the last of what I need to say according to this sheet, I will just say thank you so much to everybody for allowing me to co-host this great presentation. To our guests, Richard and Kathy, thank you for the privilege. Ronna-Rae, always a pleasure. Hope to see you in maybe a couple of months in Victoria. And again, thank you all of you for participating. Over to you, Ronna, to close up.
All right. Thank you very much, Norman. Yeah, I do look forward to getting back to a new normal. As we move into phase 2 of BC's restart plan, let's give this every chance of success in this phase by continuing to do what we've been doing all this time, staying 100% all in. Let's continue to follow the public health guidelines to protect ourselves and our loved ones and stop the spread of COVID-19 in BC. For more information on our BC Restart Plan, you can visit gov.bc.ca/RestartBC. And I also join Norm in saying thank you to everyone for joining us this evening. You keep well, you be safe, and most importantly, be kind.
Good night, everyone.
Night.
Right.